Good afternoon. I am Jaba from Sagar Hospital, Kumarswamy Layout. Today we have picked up three very important topics which we come across in our day-to-day life. While we are live on Facebook, please send us your questions and we will try to address it now if time permits. Otherwise, you can also send us offline messages. We will try to address that. Today's first topic is sleep deprivation and how it affects our health. Now, when we talk about sleep deprivation, people vary in how little sleep is needed to be considered sleep deprived. Some people, such as older adults, seem to be more resistant to the effect of sleep deprivation, while others, especially children and young adults, are more vulnerable. We have with us Dr. K.S. Kishore, Head of Cardiology, Kumarswamy Layout. Doctor, being a cardiologist, why did you choose this topic, sleep deprivation? How it is going to, affect our health?
Yeah, thank you, Java. To start with, it definitely sounds quite weird for a cardiologist to talk about sleep and sleep deprivation. It looks as if it's something which is not connected to cardiology. See, of late we are seeing a disturbing trend, especially in our country, where we see a lot of youngsters succumbing to heart-related problems and hypertension. Right. Decades ago, or a few decades ago, or a decade ago, most of the times the heart-related issues were seen in patients above 40 years of age.
Right.
The disturbing trend of late is especially since the start of this century, we are coming across more and more young people who are succumbing or who are getting heart-related events or hypertension, meaning to say cardiovascular problems.
Right, right.
So most of the times the stress is given on proper diet and exercise. One should understand that there is also another hidden enemy within, which also is responsible for higher incidence of cardiovascular diseases in youngsters or in young individuals. That is sleep. See, today's life is so fast-paced. We, the younger generation especially, who are career-oriented and who want to achieve more at a shorter, in a shorter duration. So what they do is they overstretch themselves. At least I can vouch with all guarantee that I come across a lot of young patients who have had a cardiac event or who have developed hypertension at an younger age. If you carefully look at the lifestyle, most of the times you find there are practically no risk factors. Many of these patients, it's a disturbing trend actually. You don't find any smoking habits in them, and you don't find any diabetes in these patients. And many of them do exercise. Exercise is becoming a style statement these days.
Right.
Do exercise, and diet also is becoming a style statement with a lot of celebrities watching for low-calorie diet or fiber-rich diet.
Right.
So you carefully dig into their lifestyle or their habits or the way they lead their routines. You get a hint that they don't sleep properly. You can blame on various factors. One common reason is most of these youngsters are tuned to working times of Europe or US, which is far different from what our time is. So when we are sleeping, they are awake, busy working, right. Catering to the US time or the European time. So what they do is, when everyone is sleeping here, they are awake, and when everyone is awake and busy with their routine, they don't feel like sleeping. It's quite natural when when the whole world is active around you. You don't feel like sleeping.
So they are awake.
So even though if you sleep, you tend to compromise on it. You sleep for 2-3 hours and again get back to work, or work-related issues or domestic issues would be there, which you have to cater to it during daytime.
This is how one person has questioned that he works with an MNC and he goes to sleep. He's Mr. Sen here, and he said that he goes generally to sleep at 3:30. And get up around 10 o'clock. So, and how, he questioned that without having the medication, how can he overcome this sleep deprived?
See, if it is a work-related issue where he is forced to work at these odd hours, see, there is something which he cannot change. If there is an option to change over to a better working hours, that would be great.
Right.
If you cannot do that, at least one should remember a grown-up adult will require at least 8 to 9 hours of sleep, at least on an average 8 hours of sleep. He should try to catch up this sleep Even
In
if it is
between.
not possible at night, at least he should make sure that he does this during daytime.
In between.
In between.
Uh-huh.
And again, sleep is something which your mind is tuned to it. If you tune your mind to a particular timings, invariably whether it's day or night, your biological clock will listen to you and you will go to sleep. What I mean to say is, if his shift is ending, covering the whole night, and if he's forced to sleep during morning hours, if he does it as a regular habit,
Yes, yes.
that will become a habit. So he'll stay awake during morning hours, night hours, and you'll naturally tend to sleep during daytime. You would have reset the biological clock.
Right.
It is like jet lag, overcoming a jet lag. It is something like a jet lag itself. So you should train your brain. Finally, it's you are tricking your brain. See, finally, all your habits or routine is they are dictated by your mind, and you should trick your mind rather than doing anything else. So if you tend to develop the habit of catching up 7 to 8 hours of sleep during daytime,
Right.
where you are in a situation where you can't sleep at night, I think that should be the simple and the easiest way to solve the problem.
Okay, so what are the symptoms one can see when we talk of sleep deprivation?
Okay. Symptoms, you can categorize them into the immediate symptoms and long-term effects. There are immediate effects and the long-term effects. The immediate effects are very clear, which will be visible also to people who work around them. They tend to be less attentive because they don't feel fresh. So once the body is not rested properly, anyone doesn't feel fresh, so they are less attentive. They are irritable. They try to pick up faults or mistakes in their colleagues. They are irritable for simple things. They don't be able to focus things. More than anything else, the decision-making capacity, the cognitive abilities of the brain is affected. Decision-making capacity is affected. They delay making decisions. And if someone is into driving, you know what are the hazards of driving with the sleep deprivation. Again, they are less attentive. So these are the common, and as usual, the fatigue factor is more. They feel tired and fatigued. Reason is they would not have rested. These are the immediate side effects. Whereas in long run, if you keep on accumulating your sleep deprivation, what we call a sleep debt, every day you sleep less. For example, today you sleep less by 2-3 hours, you are accumulating 3 hours of sleep debt. So this debt keeps on accumulating. Body doesn't forgive. So this debt keeps on accumulating. So it has long-term effect on your other systems of the body. See, sleep deprived people tend to release more of stress hormones in their body over a long run. And as you know, these stress hormones can cause havoc on your system. Coming to the cardiovascular system, I was just trying to figure it out. People who are deprived of sleep because of this increased level of stress hormones, they tend to develop hypertension at a very younger age. They tend to develop even cardiac events at an younger age. These days we see it as a routine. It's not surprising. About 10 years back, it used to be a surprise to see a youngster below 40 coming for an heart attack treatment. It's not anymore. Now it has become something which we are seeing day in and day out.
Correct.
So cardiac events are more in youngsters who tend to avoid sleep. And hypertension. Hypertension also is on rise in these patients. And other long-term effects on the body is, yes, chances of developing diabetes is high in these people. And they tend to either become obese, they binge eat, because there are certain hormones which regulate hunger in the body. These hormones secretions are affected, so either they binge eat or they don't eat at all. It's an extreme. Either they put on weight or they lose weight. So it's a double-edged sword.
What are the treatment modalities for this sleep deprivation, if there is any? Except, if you
as I
can
just
yoga
made a mention,
or meditation.
most of the time sleep deprivation is related to our own routine. Most of the times, 2/3 of the times. In 1/3 of the times, yes, sleep deprivation is related to some chronic illness or diseases. Coming to chronic illness of diseases is one of the common causes for sleep deprivation when it comes to illness is depression. People who are depressed for various reasons, they tend to oversleep, or the other extreme is they hardly get any sleep. This can happen in depression either ways. They either oversleep or they don't get sleep at all. So both are possible. This is one of the common conditions where a person is deprived of sleep. There are other chronic illnesses which are rare which causes sleep deprivation. If someone is depressed and not getting sleep because of that, I think one should seek medical attention. Here definitely medical attention is needed, either in the form of medications to treat depression or other modalities to treat depression. Treating depression will definitely improve the sleep. Otherwise, most of the time, the sleep deprivation is always related to our routine, where we tend to focus more on our work, less on sleep. So you are deliberately avoiding your quality sleep. So the best way to correct is make sure you catch up enough amount of sleep, at least 8 hours a day. In case if you are not able to get sleep, even after going to bed, see, the simple way out is to indulge in some form of activities, like exercise, any form of exercise, any workout, half an hour to 1 hour a day, will keep you fresh and you will get a sound sleep. The other way out,
suggest yoga, meditation?
it could be anything. See,
etc.?
exercise could be anything according to individual size. It could be yoga, or it could be gym, going to gym, or it could be a brisk walk. Anything wherever you burn calories, your body, you will feel tired, and you will naturally you will have a good sleep when at the end of the day, because you would have worked out, you would have gone through your routine, so you would have burnt out enough number of calories. So obviously your mind will be in a better position to rest. Other alternatives, there are instances where despite this some people still have disturbed sleep, where they can't sleep for long hours. These are the people who should try out meditation. Meditation is a thing which will do wonders in this. See, finally you are practicing mindfulness with meditation. Most of the times you don't get sleep because your mind keeps wandering,
right,
beyond your control.
Right.
The best thing meditation can do to you is you will be mindful. Mindful means you are in the present, you are present in the given moment. You know what you are doing. This is where your unnecessary thoughts crossing your mind is avoided, and you will definitely tend to get good sleep. Meditation, it takes time for it to have an impact on you, but patience and persistence will pave way for a better sleep.
So we are almost coming to an end of the program. So if any of you want to make an appointment with Dr. Kishore, please call us at 080 4299 9999. Thank you so much.